that was really interesting. Thanks, guys. I suppose it's a slight reflection that would be interesting for all of you. So I'm really interested in this idea of information, and it's really exciting that there's lots of new ways of collecting data, and it's great that you can produce a map of Blantyre that actually shows where all boreholes are. It's great that there are these platforms. I suppose it's more just from your experience or just for everybody really is, actually I think one of the big problems is how do we get people to really use that information. It's like there is a lot of information which doesn't get used. And even the information we already have doesn't get used in all the amazing information that sits on the DHS websites and the NICS websites just doesn't get used. So, I mean, maybe just any reflections from the panel on not only how do you do these interesting pieces of work, but how do you then make it really accessible? And my slight sort of anxiety is always, I don't want to spend all day on my mobile phone telling some weird bureaucrat somewhere that my toilet is working. So how do we actually kind of make that happen?
Yeah, I mean, that's a really... Sorry, is this working? I think that's working. Yeah, it's a really good question. There is a lot of data out there, and more data is being collected all the time, and we're contributing to that sea of data that's coming in. And one of the things that we always work very hard at is making that data relevant and digestible. I don't know if you remember during my presentation, I was saying before we even touch the technology, we kind of map out what's got to happen. And one of the things we're really keen on doing is keeping everything as simple as possible. Quite often when we go into a new program and we ask what data people want to collect, they come up with a huge list. I've seen some of these registers that are filled in at the down at the primary health facility level, and the questions, the obvious question is, what are you going to do with that information? Who's going to look at it? What's going to happen if you don't send that information in? Is it going to make any difference not having it? So what we try and do is identify just the really key bits of information that are actually going to enable people to use them and make an informed decision that leads to an effective action. So once we've narrowed down the data sets, if you like, that we're going to collect, we then think about how we're going to present that data in the most digestible way that's hardest to avoid doing something with. So simple graphs, simple charts. Who needs to see that information? So how can we put it to them in a way that's difficult for them to avoid? So rather than asking people to log on to a system every day, why don't we just tell them to assume everything's fine unless they hear from us? So we push information to them that's key. So, if they're managing stock, for instance, you can just say, unless you hear from us, you can assume everything's cool. But if you get this email, it will identify, facility A and facility B that are running low and they're going to need restocking. So it's using, I guess, a more intelligent approach to the data rather than just overwhelming people with a sea of information. As I say, it's trying to minimise what we're collecting and maximise the impact of the information when we've got it in the most effective way. In terms of how you engage people, like you say, if you're a member of the community and you're continuing to being asked, have you used the toilet today? Have you washed your hands today? Again, that can be quite annoying, I would imagine. And there's so many SMS type incentives out there or pro-interventions out there, they become less and less effective the more they are. So again, it's a matter of tailoring your approach. And I mean, some things you can do, you can make it more fun, for instance. So you could engage people in interactive quizzes about what they're doing. Make those quizzes less irritating by spacing them out a bit better. Introduce some kind of gamification. So, there is a reward, potentially, either a financial incentive, distribution of airtime, credit, or mobile money, which is very easy to do. We can hook into any of those types of financial incentives. But also, some things that work better than financial incentives are, just letting people know that what they're providing is of real value. So, you can have like a gamification that leads to, you scoring on the leaderboard. You're the most effective. Congratulations, you're the most effective provider of data, and your data is leading to all these different good things. So keep the data coming in. So it's just a matter of keeping in mind all the time that whilst yes we can provide really neat technology and great data. You're interacting with human beings all the time, and you've got to bear that in mind in the design of the system and the use of the information. I could talk all day, so I'll stop there.
Is this one? Yeah, I'd just add to that as well. Being a fairly small NGO as we are, innovating these extra little things, you might say, well, it's better if we just have one big system rather than lots of new developments all the time. There's something to be said for both, really. Our specific project had quite niche requirements in how we're directing the teams to vaccinate dogs that weren't available in the current off-the-shelf kind of things that are out there. So I think having the variety it means that innovation moves faster and new ideas crop up and get explored, and then over time maybe they'll get merged. And it depends on, as Andrew says, the requirement of the local project. And as long as it's relevant to that local project, then it will get used well and will have relevance in that local area. I suppose there is then a question of how we link up these many small platforms that are out there and get the relevant data into the central systems like DHIS and OIE, WHO's databases and things like that. And I think it's just knowing what the information is that they require and being able to plug that data directly into those systems. So I think it'll be an interesting decade over the next little while.
Thank you.
Could I just add, actually, from sort of a research standpoint, I think there's also an aspect of this also, which is the fact that quite often we have information about WASH, but we don't have descriptive enough information. And when you go to sort of relate WASH data to health outcomes, there aren't always the statistical ways to do that very easily. So that was sort of part of the work that we were doing previously. And there is a huge role, I think, for statisticians really to get involved in this, because you have to think very carefully about what kind of data you have, what kind of data you need about the WASH, and how do we quantify that somehow, and how do we relate that then to health data. So.
Okay, thank you. Any questions?
Thanks, Andrew. Very nice, neat presentation and a super little One Health project. Do you have any plans to expand? I mean, rabies is all over Africa in particular, and obviously in the Indian subcontinent as well. Can it be expanded, and what's the constraint?
So from the rabies side of things, absolutely. We're working in Goa in India and trying to expand our work in Malawi. It does require a more regional joined up approach. It's obviously a huge problem and requires enormous amounts of funding, and until we have the political will to do that, then it's difficult to really gain traction. But I think particularly in India, the methods aren't known or haven't been demonstrated, and so that's what we're really trying to work towards at the moment. Is demonstrating how you achieve an impact so that other governments of other states can start to apply those on the ground. And then systems like these mobile technology systems are very easy to scale up once someone has the resources on the ground to actually use them. So yes, we're very keen to kind of make this more widely available on similar projects.
So I think the gentleman there behind me. Sir? Yes, yourself. Do you just stand up and just speak, because we won't get the microphone to you quickly enough.
My name is Mullett. A question for Luiza. The CBS container-based sanitation that is happening, you said in Kumasi, in Ghana. I find that very interesting because in Ghana, one of the reasons why we were not able to do very much in MDGs for sanitation was because many households were using shared toilet facilities. So a CBS technology such as this probably may be useful in improving uptake of toilet or sanitation facilities at the household. But my question is it the private-public partnership venture that the CBS technology is doing with us? And secondly, how does it fit very well into the government's policy of promoting sanitation at the household levels, where individual households are encouraged to build flush toilets?
Okay, thank you very much for your question.
Sorry, did everyone hear the questions? Yes. Thank you. Karen.
Yes, the first question was about if it's public.
Private partnership.
private. No, it's not. At the moment, it's a private initiative. As I said initially in my presentation, I mentioned that it's financial. The business model, how the CBSs work, it needs to be discussed and also defined what is the better model, if it's a private, public-private partnership, or if it's on a private initiative. But from the WhatsApp and EY report, it shows that the CBS, only as a private, would not work. They do need the subsidy, the government subsidy, right? Otherwise, it's not gonna be profitable or work or pay for the operational costs of the company, okay? And but regarding to making it as a more, there is also no comparison at the moment with the CBS with other interventions, sanitation interventions. This is something that needs to be done. There is a gap there, okay? Comparing, for example, CBS with maybe with the septic tanks or even with the sewers or other intervention that is used. Or any model that, for example, where the traditional pit latrines, where the operator comes to your house and you phone them to come and clean your pit when it's full. So needs to be compared as well. There is a gap there. There is a gap there also to look how the CBS is impacting on health. It's not clear yet. So research for us to work together is an intervention, because we see that is a system where there is a risk for the operator who takes the waste, who collects the waste. And I like very much your presentation with the microwave truck, because I can see because from London and Navasha study, we can see that the perception of London canal boaters here, they don't perceive as a risk for contracting diarrheal disease, although they are aware of there is a pathogen on the waste, right? So how they can manage well, and if the CBS in developing countries can take similar approach where the user is responsible for maybe putting their waste outside or in a place safe, or maybe like the truck who comes with the microwave just to treat the waste immediately, will be great. Well, that's my vision anyway. I don't know, but I think that the model, the CBS model, needs to be improved. Right? They are interested in models for treatment of the waste that they don't have. So also comparison between treatment process. What would be the better for the fecal sludge as well? It's another gap as well. When I say comparison, when we look at economic costs. I don't know if I answer your question.
Well, you tried, but the other thing I want to ask is, what's the acceptability level? Are many people interested in using the CBS in their households?
If people are interested,
yes.
I don't have that answer for you, but I believe that the companies, for example, the clean team, I'm aware that the clean team, they have a team working, selling the system in a daily basis, talking to householders or the clients on the street to persuade them to join their service, right? So I don't have that answer for you in terms of they want to join the CBS.
Okay, maybe I can comment on that, because we were working together with Synergy, also in Kenya, and the households were very happy with it, and they were also using, for instance, ash after each defecation, using the toilet. They were using ash to prevent any flies and smell, etc. And the material was collected, but the people were really willing to pay for it. Yeah, and it worked quite well.
I think we have another question.
Related to this, my name is Jutta Reinhardt from Merck. Related to this for Tineke and Luiza, you mentioned in your presentations you need a transportation system, right? Have you any example how far can you reach into most rural settings with your technologies?
There is no research on that yet, but transport is a cost on this for the service providers. Some of the service providers, they have a model where they collect the waste and take to another transfer station where a truck comes and collect the big waste container, right? So needs to be looked at that, the business model, which one would be work better as well.
Yeah, so the business model is different indeed for each and every location. Also depending in how far you can reuse the material, how far transport is, how easily accessible the location is, etc. So that makes it very challenging and complicated because each time indeed you have to think of new strategies maybe or make modifications.
Thank you. I think we have time for one more question.
Yeah. Okay. Just a couple of comments on one. First of all, on the dog vaccination, I think that's great. I mean, having worked all my life overseas, it's always been a problem that, you know, dogs have got not vaccinated. In the 60s, my wife was bitten by a dog, and we had to have all the sort of treatment. So that's a second comment is from Michael from Imperial. Looking at the outcomes of your stuff, I'm surprised that there is no new data on how to deal with schistosomiasis. I mean, the stuff that you're talking about, I knew about in the 60s. Yeah. And when I was working in West Africa in the 60s. So there's absolutely no, but, you know, information and your stuff is there, but there's no new technical or book data about it.
Yeah, it goes back to, yeah.
The third thing was the third thing that I would say is on the IHE program. Great. I mean, I'm an ex-Oxfam technical person. I'm just wondering, I mean, in terms of the truck, if you look at the context of what's happening in Bangladesh at the moment for Rohingya refugees, you couldn't get a truck anywhere near the thing. I wonder whether you've looked at the options, because in terms of emergency sanitation, there's a real key problem there. And that may well be an option, but it won't work in terms of a container or a truck. But I just wonder whether you've looked at any of the other options around that.
No, that's true, and we're looking at many different options. And you're right that there's not one solution that will be helpful in all cases. So we're also working on other technologies and other treatment approaches that may be applicable in situations where you can't bring in the truck. But there might be many locations where it can be very helpful. But it's difficult indeed to find like one solution that fits everything. Yeah, that's true.
Okay, and if we've got time for supper this evening, we'll get the answer about the 1960s.
Sure, okay. Did you want to comment on the rabies one too? Or?
Just thank you very much.
Yeah.
It's really good to hear.
Yeah.
Obviously, huge problem out in Malawi, so yeah, appreciate it.
I'm actually married to a vet, so I appreciate your talk too. Just dog health, I guess. It sort of goes back to what Alan was saying. I mean, yeah, if you do a literature review of sort of what's known about water, how to treat water for schistosome cercariae, most of the papers you come up with are from the sort of 40s, 50s, 60s, or before that. Part of that's because Praziquantel came along and was so successful, and that's where all the efforts went. People forgot about WASH, I think, for a long time. And one of my PhD students, Laura, I'm going to put your hand up, Laura, she's at the back there, has done a systematic review currently to sort of compile all the information that's known. And there are actually some big gaps. A lot of the data is only for certain types of schistosomiasis. A lot of the studies were only done in sort of very ideal laboratory conditions. I mean, I can sort of guess and give you some ideas of how I think you could treat the water, but in terms of the rigorous scientific information, it's pretty limited. But there's a workshop this afternoon. We'll talk about that more, I think, this afternoon. Yeah.
Good place to end there. Any housekeeping before we go?
Yes.